Doctor, please, after the first baby, is it advisable to have the second baby? I mean, whether after 3 or 6 months.
After 3 or 6 months, she wants to rush. Well, that's what we call maternal depletion syndrome. Maternal depletion syndrome means the mother is getting depleted of her normal body constitution.
Okay.
And that occurs when a woman gets pregnant. The baby feeds on the woman. When the baby is born, the baby depends on the woman. Breastfeeding. Before you finish breastfeeding that, you are now having another baby. So meaning that why before you even finish breastfeeding this one, another baby is also sucking in you again. So if this one continue on and on, it's not good for the life of the lady. And that is why it is advised that at least 2 years should be in between them, in between the first child and the second one.
At least 2 years?
At least 2 years.
That's good. Please, sir, what can one use to treat hemorrhoids? It has been troubling since February this year. I've done all I could, but no improvement. Thanks.
Hemorrhoids cannot be treated by self.
Okay.
If hemorrhoid is what she called hemorrhoid is what it is. There are stages of hemorrhoid. You have stage 1, stage 2, stage 3. And at each stage, there are recommended treatment for it. You know, the stage of bleeding along the stool, I think the fellow need to go to the hospital.
Okay.
But the final stage is surgery. That's the final stage.
All right, we have a call. Hello, you're on to Healthy Living. Hello, yes. Morning. Tell us your name and where you're calling from. Hello.
Okay, my name is.
Hello. Well, I guess the network is bad. Please call us back. But when you do that, the first thing you should do is to mute the volume on your TV set so that we can hear you loud and clear. If you have 1 or 2 contributions or you have questions you wish to ask the doctor here, please do that. Call us and we'll appreciate your call. Thank you. That's person saying, I appreciate your good work, doctor. May God bless you and bless Dove Television. Amen. I breast itch. What should I do?
Again, we have to establish what causes the itching.
Okay.
And I think that cannot be done on the air unless we see.
See what?
Yes. So she needs to go to the hospital.
And okay.
But it's a simple problem. It's not a big deal.
Okay. This one saying, please, doctor, she delivered 2 of her children through CS. Tummy is very big. Please, what can she do?
Yeah, delivering through CS is not a contributory factor to a big tummy. Usually, a big tummy is, by the way, associated with feeding.
Eating late?
Feeding, exercise.
Okay.
Yeah, feeding and exercise.
Okay.
When you eat, during pregnancy, during breastfeeding, a woman eats a lot. And so if you are not very careful, you begin to grow fatter and fatter and fatter. And the first point of all is your tummy. That's where the thing get deposited. And that's the fat get deposited. And if you are the one that is watchful, watch what you eat, do a lot of exercise, especially
sit up,
press up, or sort of ups.
Okay.
Yeah. You are likely to.
Thank you, doctor. Hello, you're on to Healthy Living. All right, we lost that call. Please call us back. Thank you. Hello, doctor. What's the best form of family planning?
the best form of family planning is not available. That is the ideal, because ideal must be available. You must not free of complication. You must not have everybody must be able to apply it. There's no, and there must not be side effect. So this one is not available. It's not available. What ideal? It depends on what she likes.
Okay.
Again, maybe let me just quickly review the availability, the different methods that are available. You have natural,
Okay.
whereby you watch what you when you are likely to be pregnant and avoid sex around that time. Yeah. You have barrier method where you use condom.
Okay.
Natural also includes breastfeeding. It's
Okay.
part of the natural. So we have barrier using of condom, diaphragm, both male and female condom. Then you have tablets, pills you take every day. You have injections. Then there is IUD, and there is implant. The one you just implant, just like matchstick.
Wow.
You implant it under the skin like this. And that one can take 5 years, depending on the weight of the individual.
Okay, that one has to do with weight.
It has to do with weight.
All right, we'll have another call.
Yeah.
All right, we lost that call there. Please do call us back. Thank you. All right, depending on the individual weight.
Yeah.
Okay, without the weight, you can't insert that. You can't have that in your body.
I mean, if the weight is above certain level,
Oh, okay.
the effective year will be reduced.
Oh, okay, I see. Hello, you're on to Healthy Living.
Hello?
Please, can you reduce the volume on your TV set?
Okay. Okay. Can you hear me now?
Yes, we can hear you. Tell us your name and where you're calling from.
Okay. My name is Neka. I'm calling from Benue State, Makode.
All right, Ineka, go ahead with your question.
Okay, I have hepatitis and I just delivered my baby. I want to know how I could go about treating it.
All right, thank you so much. The doctor will get back to you.
Okay.
Yes. So you heard that she just delivered a baby. She has hepatitis.
There is hepatitis A,
Okay.
B, C also. I assume she's talking about hepatitis B, which is a blood form,
Okay.
and which can also be passed to the baby. Yeah. That is why when she has just delivered, ideally she will immunize the baby before giving breast as a first dose, then 6 weeks later, and then 6 months later.
Okay.
That's 3 doses for the baby.
Okay.
That's for the baby now. For her own, first, before you can commence on any treatment, you have to look at, you have to do further tests. You send her for viral load. If the viral load is small, there's no need for treatment.
Okay.
There are a lot of women that has it here, there, and because their viral load is low, there's no need.
Okay.
Yeah, it's just. But if the viral load is high, then there's a need for treatment.
All right, thank you. This one is saying, hello doctor, have been having painful monthly cycle and is absent at some month, which is last month. She saw it, but this month she's having breast pain.
Yeah, breast pain or engorgement, breast tension, tenderness, that's part of symptoms of part of symptoms of menses. When menses is coming, those are a few things a woman will experience. But again, I think she needs to get to the hospital. If this continues, especially the breast pain, then she will be taught on how to do self-breast examination.
Okay.
To be assured that it is not associated with any lump.
All right, we'll have a call. Hello, you're on to Healthy Living. Hello, you're on to Healthy Living. Hello, please tell us your name and where you're calling from.
My name is Uju Emeka.
Okay, please, where's Uju calling from?
I want to check the doctor.
All right, please go ahead with your question. The doctor is here.
I have a stomach hot pain. My stomach is hurting me always. Sometimes I go to doctor, I go lab, they say that it's infection. Hello?
Hello.
I can't understand.
Doctor said you should please go back to your question again. Please, can you please tell him what you said just now?
I said that I have a hotness of stomach. My stomach, my womb is always hot.
Okay.
They said that it's infection that causes it. I've tried what I can try. I've got injections and everything, drip. There's nothing. It's still hurting me all the time.
All right, please, doctor will get back to you. Thank you.
Okay.
Yes. Wow.
Yeah. For as a general information,
Okay.
when you touch your hair like this and you touch your tummy, there is a little bit of difference in the sensation
Of both.
of both. So the tummy will be a bit warmer than
The head.
the head. So if that is what she's calling hotness of the tummy, I don't think that is right. That is a complaint. Well, I don't know what she meant by hotness of the tummy. Ideally, if there's any problem in the tummy, it is rather pain, not hotness.
Okay.
It is rather pain. But at any rate,
I think she also complained of her womb also, hotness in the womb.
how does she know that the womb is the one that is hot?
Okay.
The womb is embedded inside and inside.
Okay.
You know, if she's feeling any sensation, let her go to the hospital.
She has been through to the hospital. She has done lab tests. She has done all the things.
And they said it's infection.
Yes.
If they say it's infection, then they go ahead and treat.
Okay.
They go ahead and treat. If it is infection, you go to the hospital, you do culture and sensitivity. If it is infection, you do culture and sensitivity. It will reveal what drug that they are to use. Yeah.
Okay.
So there's no big deal.
All right. Thank you, doctor. Is there any family planning injection or medication for men? This is coming from Mr. Ajayi.
Okay. For men, no.
Okay.
You have, right now, you have two forms of family planning for them.
Okay. Which is
condom
okay.
and vasectomy, that is permanent family planning. That is, the testicle is being hanged by the cord. The cord will be identified and cut and tied. That is permanent.
Permanent?
Yeah, that's permanent.
Okay.
Yeah. It's just like tubal ligation in women.
In women. Okay, but that's that. Once it's permanent, then you can't
reverse it again.
Oh, okay. So, but this person should be sure that you have all your children before you go and cut. All right. Thank you so much. Hello, you're on to Healthy Living. Hello, you're on to Healthy Living.
Yeah, I want to talk to them online. Yeah.
Hello, can you please reduce the volume on your TV set?
Hello.
Please reduce the volume on your TV set. I can hear my voice from the background.
Okay. Good morning.
Morning. Hello, yes. Your name and where you're calling from.
Yeah, the name is Victor, calling from Port Harcourt.
All right, Victor from Port Harcourt. Your question, please.
Yes, I have the situation on hand that my eye blood, each time the head shakes, it stops my movement because the eye is just blood, you won't see very well and makes a any kind of staggering movement, you can't move very well. But when you are steady, there's no problem. But when the head shakes or something, that's when that problem comes up, and it's kind of
Hello,
continuous.
hello, Victor. Please come again with your question. Did you say your eyes?
Yes, the eyes. It's kind of bloody. Each time the head shakes. You understand? When the head shakes, that is an even affect movement that you cannot move. You can't move very fast.
Okay, you mean when you try to shake your head?
Yeah, anytime there is a movement on that head.
Okay, so it affects your eyes.
Yes, because though I've been through some illness lately, which I've been treating, but I don't know the actual cause of this one, and that has not gone.
Okay, so what kind of illness? Can you please tell the doctor what kind of illness have you been treating lately?
Well, it's complicated. First of all, they say it's kidney, but the kidney is being taken care of. There's blood cancer, which with prayers even from the G on the rest, they could no longer find it. But it's just learning this one now.
Okay. All right. Thank you so much. The doctor will get back to you. Wow.
The eye is blocked.
Yes. If there's a bit of movement from the head, they definitely affect the eyes.
I think she would need to see an ophthalmologist.
Okay.
Yeah. Since she had even gone to the hospital to treat for kidney, for
Cancer
of the blood, leukemia, I think she should do that in the hospital. It's not a thing that we can answer yes or no here unless we see
what's actually
happening.
All right, thank you, doctor, and thanks for answering the question to Mr. Ajayi, the family man that wants to do family planning. If someone is pregnant,
maybe let's not forget.
Okay.
Another form of family planning
for men.
Could be agreement with the wife. The husband should be involved.
Okay.
Whatsoever the wife wants to do, she should be involved, empowered. The woman should be empowered by the husband. I think that's
All right.
Yeah, not that the woman should go behind
and do it, or the man should go behind.
The two of them.
Okay, they should come in agreement. Yeah. All right, I'm definitely sure he has gotten that. All right, this one is saying, just read it just now. What could have caused waist pain, stomach upset, strong to atomy, and this person is throwing up, vomiting? Is it acute malaria?
Yeah, if we rule out pregnancy, that is, if there's no pregnancy there, it may be as a result of malaria. And so she may need to just take the common malaria tablets that you can you can lay your hand upon, artemisinin with lumefantrine combination. That would be good for you.